Hello everyone, I'm back again. I actually tried to record this video yesterday and my camera stopped recording, so we're on run 2. This is, if you haven't already watched, I just updated on Gus and what's been going on, and then this video will be basically kind of a overview of what's been happening the last several months and why I haven't been on here in a long time. Okay, I'm going to try to just really keep it short, but anyway, so it started about a few weeks after I had Gus. I started having lightheadedness and pretty much all day, and it would just happen when I did certain things, like going upstairs or reaching for things, keeping my arms above my head or leaning over or whatever. And then over the course of a couple months it increased to chest pain and short of breath and heart racing, palpitations, and all sorts of fun things like that. So before it had increased to that, I saw my family doctor originally, then he sent me to a neurologist thinking that I might have something wrong that way. And I saw a neurologist, and I did have an MRI done prior to seeing him, and he did see like a small amount of scar tissue on my brain, but he wasn't concerned about it, because he said there's no way for us to know how long I've had it, if I've had it from birth or anything like that. And he said I wouldn't be having any of those symptoms from that. So he wasn't concerned, and neither was I. So we both decided that it had to do with my heart, and he referred me to a cardiologist. I went and saw her, and we just basically did a bunch of tests, blood work, and did a Holter monitor, and where you just hook up a bunch of electrodes and you wear a monitor for, I had to wear it for 8 days, 8 days, and it just reads your heart rate constantly and whatever, and then you push the button if you feel any symptoms or whatever, and record those. Then you turn it in, and they look over it and see if they've seen anything abnormal. And the first time after they read that, they said I have a possible atrial fibrillation, which is basically your heart's supposed to beat like this, the top chamber, then the bottom chamber. Well, mine was going like this, fluttering at the top, and then it would beat at the bottom. And it only did that for 4 beats. So, but if it continues to do that, then you basically are dying and your heart needs to be shocked back into rhythm. But mine was only doing it for 4 beats, and then it would go back to the regular rhythm. So so they didn't diagnose me with it, they just said it was possible that could be what's going on. Anyway, so they had me wear another monitor for 2 weeks so they could see more detailed stuff, and like my heart would race and things like that while I was wearing it. So they wanted me to see a rhythm specialist, which just arrhythmia specialist. They just specialize in the electric part of the heart. And before I saw him, I was on 2 different medications over the course of wearing these monitors. And the first one was a beta blocker, which basically just lowers your heart rate so that it won't race and do things like that. But it gave me extreme fatigue, which is common with those, but it was just so bad. I was fatigued just sitting on the couch, you know, just tired. I couldn't do anything. You can imagine what that's like with 3 kids running around. And then, so they took me off that, and they put me on a different one called, it's a calcium channel blocker, which basically, it does the same thing. It lowers your heart rate, but it doesn't have that type of side effect. So they put me on that, except that it started to give me severe leg pain, which we actually thought that it might have been a blood clot. So I had to have that checked out to make sure I didn't have one, and I didn't, luckily. So they took me off that. as well. So I have not been on any medication since then, and which they actually didn't even work. I was on for a couple weeks, and then after a couple weeks my symptoms just kind of came back, so they didn't really help anyway. And then oh, I also had an echocardiogram before I even saw my cardiologist, and they did find a PFO, which is a patent form ovale, which is just basically a hole in the heart. And they can be very small, they can be large, they're very common. Like, you could have one and you wouldn't even know it. They don't normally present symptoms, so they don't even have to fix them unless they're large enough. So yes, so I have that, and then so I saw the rhythm specialist, and he said there's nothing electrically wrong with my heart. I'm not having any arrhythmias or anything like that. So that wasn't helpful. So now I'm basically just at a loss of what to do. I honestly do not know where to go from here, because they just keep writing, these doctors keep writing me off as just, I don't know how to help you. And I don't know if it's just because I'm not their typical patient, like I'm not in a geriatric age range, or like I'm not presenting as having heart failure or anything like that. So they just kind of keep telling me that they don't know what's wrong and they don't know what to do. So I don't know what to do. And it's extremely frustrating. I hate it. My symptoms get worse each week, and it's hard to take care of my kids, as you can imagine. It's really, really hard. So what I'm doing next is they set me up with a doctor that specializes in PFOs and doing those procedures to close them and things like that, just to see what he thinks about it, if it's causing any of these problems. And so I have to go do that. I don't know when yet, though. So that's my next thing. I doubt he'll have any answers for me as well, but I don't know. I just want someone to at least, you know, put more effort into helping me find out, because they're not doing that, and which makes me angry, because I'm at one of the top hospitals in the country, and I don't know. So anyway, if there's anybody out there, basically I just want this video out there just so that you guys kind of know where I've been, and so that if there's anybody out there that has some advice in this department, or I don't know, any ideas of what I might be able to do next, I don't know. I'm just kind of hoping someone might have some sort of information for me, but if not, oh well, at least I tried. But so yes, that's what I'm going to be doing next, and if I end up having anything go on, I'll kind of keep you posted, I guess. And that's it. So that's what's been going on. That's why I've been gone for a long time, and because it's just been hard to even take care of kids, let alone stop and do a video and whatever. So yes, that's that. And if you haven't checked out the update for Gus, that is already up and you can watch that, and we will see you guys on the next one.